Thanks, Susie. Thanks, everyone. Lovely to see you all here. Thanks for coming to our symposium. I'm Dora and I'm the Knowledge Translation Lead. And today I have the pleasure of introducing you all to iMPACT, which is a new internet-delivered cognitive behavioural therapy-based self-management program for folks who use methamphetamine and more specifically want to change their relationship with it. So just in this 10-minute talk, I'll go through the background of the product, so the whys and wherefores that we've undertaken such a thing, the development process itself, touch on the program features, the implementation, and then talk about the future directions. So last year at the NCCRED Symposium, my whole presentation was about why should we do an internet-based CBT for methamphetamine, so I won't dwell here. But in short, we know that internet and mobile phone-based health interventions are a new wave in health service design. And as such, there's a significant amount of potential for us to explore new ways to address some of the incidents and health harms of methamphetamine, like long wait lists, the treatment access gap, which is estimated to be up to or beyond 10 years between the first time an individual experiences harm from their meth use and they get help. There's also a recognised need for a step care approach and low threshold interventions. But we also know that there are no approved pharmacotherapies, and that in the first instance, when we're working with an individual who presents with methamphetamine dependence or use disorders, that psychosocial interventions are generally where we need to start. And so couple that on the backdrop that CBT itself is a very didactic therapeutic modality. It's a set of teachable skills, and there's a huge precedent for CBT being used in self-management systems, basically for a range of different conditions. And so within that, there's a huge research gap and one that we're keen to start exploring. And so on that backdrop, we set out to translate CBT into an online program for methamphetamine, and that involves the culmination of a variety of different factors, including CBT itself and CBT then delivered online as per the This Way Up model. Then we're talking about CBT for meth specifically, and how do you, what does that even look like? As well as other counselling and therapeutic models. The other thing that comes through, so other research around internet-delivered interventions, is that tailoring for people who use methamphetamine may have been a barrier to uptake. And so we having a good think about that and engaging consumers through consumer focus groups and resource review exercises in order to try to tailor this product to people who use methamphetamine. Most importantly, wrapped around the whole thing was a clinical reference group, and the clinical reference group was a multidisciplinary expert team who steered the product and then reviewed the outputs of the product as they were coming together over a series of meetings across a couple of years. Then there's also the digital health stuff, which is clinical governance. How do you ensure that the people who are using the product on your online platform are safe? And how do you preempt and ameliorate risk or adverse events within that context? There's also the digital governance stuff. So like, what kind of platform do we need? How big does it need to be? What does it need to be able to do? What kind of features? How can we keep people's data and information safe and secure? And so there's a bunch of stuff that comes together in trying to translate CBT into a program for methamphetamine. So where we've landed is in a product called iMPACT, if you mightn't have already guessed, which is basically a modular 5-lesson plus 1 bonus lesson. Don't tell the people completing the program that. It won't be a bonus, but it's a 5-lesson modular program which is designed for internet-based delivery. It's a self-paced program, but we'd suggest, our estimation on the way that will roll is roughly weekly. The product itself contains around, more than 30 CBT-based activities, which we derive from that range of sources that I talked on just before. Along with the 5 modules, there's 5 homework practices a la CBT. Anyone who knows anything or has ever done CBT knows that it's all about homework and things like that, but we called it practice to try to reframe that. There's also 10 character videos. So those folks on the side of the screen there are our characters who we use them as a learning design approach, basically, to try to show more complicated CBT techniques being undertaken in a more naturalistic setting, although they were scripted, not sort of real people. But Franken client coalescing of lots of different people, I think collectively we'd worked with over the years. And there's also 5 instructional or informational videos. So again, these are more tailored instructional videos about a specific CBT technique and how do you do it and what are the 5 steps to solve a problem, or whatever it might sort of be. And so just as a bit of a sneak peek of that, I suppose, this is the way that it's sort of looking. It's, as you can see, there's our 5+1 secret module and our 5 instructional videos there. So we've ended up with something, which is quite visually attractive, that we're pretty happy with in that way. And this is just a bit of a snap of the sort of, it's probably hard to see from where you all are, but there's more worksheets than that, but this is sort of the look and feel of them and the way that we've tried to create something that was sort of adult and attractive but accessible and visually engaging and things like that. So in regards to the implementation of the product, I guess it's a watch this space type scenario. iMPACT will be released as a research project in early 2025, and our research design is currently under ethical review, and it'll be an evaluation design. We'll be looking at participant progress using standard validated measures, as well as doing some qualitative stuff, particularly around the acceptability of the program, in order to, I guess, to iteratively design it over time and understand how it can be better adapted to meet the needs of the individuals who we hope to benefit from this product. And that said, if you haven't already, or if you're not already on our mailing list, there's a QR code there, or you can jump on our website, and it's, I think, pretty easy to find how to subscribe. So we'll certainly drop it there, but there will be a broader sector engagement piece. So hopefully you'll be hearing from me soon as we go and try and introduce it a bit further. So what does the future hold for iMPACT? I guess as I started on, there's a huge amount of unanswered questions around digital health more broadly, specifically digital health approaches for people who use substances. And the research is really pointing towards the importance of sort of blended or integrated care approaches. So integrating or using digital products like this as an adjunct to real contact with real people, i.e. in telehealth or web-based settings. And that's something that internally we're really keen to have a look at. We also hope to, as I already pointed at, use some of the consumer feedback to sort of iteratively design and improve the product. And yeah, I guess generally we want to understand if the program does what we hope it will do for people, and if so, why, and if not, why not? And that involves understanding things like who would pick up a program like this in the first place, and who wouldn't, and who does it work for? And also then things like how can the program, or how does the program get adapted in naturalistic use? So we've sort of set out this 5-session modular delivery, but I think it's likely that as people go through the program, they'll probably start to use it in much more, ad hoc or individualized ways. And so understanding how this type of product gets adapted by people, within that context. So just to, I guess in closing, products like this, I've been in the driver's seat on it for the better half of the last 2 years, but it's always a total village to put something like this together. So just some acknowledgements there, but particular shout outs to Seb Baird, who you'll just hear from in a sec, as well as the team at This Way Up, who were very generous with us in providing us resources and advice in our quest to develop the first that we know of in the world, I think, internet delivered cognitive behavioural therapy program for people who use methamphetamine. Just want to shout out to the folks who did our consumer groups, and also the team at Double 12, Brie Carter and Matt Cribb, who did the digital design and made them look so beautiful. I don't know where I'm at for time, but there's the references, and thank you.